You are in the hallway completing your documentation and reviewing orders. You receive the following call. This is Dr. Smith. Please get Mr. Klosky ready for his colonoscopy. I just spoke to him and his wife. He has had this procedure many times before. The unit secretary calls to tell you that Hannah's roommate is here to pick her up and ask if she is ready to go. The UAP comes to the hallway to tell you that while helping Kristen out of bed, the NG tube got pulled out. The charge nurse tells you that you will be getting a patient after a cholecystectomy after Hannah goes home. In the next several slides, you will be making some decisions related to these situations. All right, so now you've heard all of the situations for this prioritization just-in-time questions. So get out your phone, pause the video, scan the QR code, and you have several questions that you need to answer about that. You talk to Kristen after her NG tube is out, and she is not complaining of any nausea or any pain. You're ready to discharge Hannah. When you go in to see Hannah, you provide her discharge instructions. Her roommate asks if she is safe or what special precautions should be taken at home. Hannah is discharged and housekeeping has been notified to clean the room. Your phone rings and it is endoscopy telling you that Mr. Klosky is on his way back. The doctor calls and tells you that it is okay to leave Kristen Brown's NG tube out, but to keep her NPO and to notify them if her nausea and vomiting worsens. The doctor asks, how is her pain? Pedro Diaz's doctor is making rounds and asks, how is he doing? I see his hemoglobin is low. I'm trying to decide if I want him to get blood. Is he stable? The charge nurse tells you that the surgical patient will be up in 30 minutes. The next several questions will walk you through these situations. All right, pause the video now and get out your phone and scan these. There's several questions in this next section of prioritization. Mr. Klosky is resting comfortably. His vital signs are displayed. You assess him and determine there is no signs of rectal bleeding. You make sure he has his call light. After you settle Mr. Klosky, you check in on Mr. Baker. You now get ready, and you check in on Mr. Baker. You now get ready for your patient from surgery. Click on the exit door to get to the next stage, and the next several questions will work you through these situations. This is your room that is ready for your patient from surgery. Your patients are all settled and you prepare to give report to the next shift. Click on the door to complete the scenario.